look at the uh, coronavirus itself, it's a I'm not sure how much of you know about the virus. It is an RNA virus. Most of the viruses are RNA viruses. They spread rapidly. As you look at it, you can see the name corona came from the spikes around the virus, and it has a lot of effects on the human body because you can see the spikes and the damage it does to the tissues in the lungs, especially. It is very virulent, and it came from the wet market, which is from China. People they usually eat this exotic animals, and it was contaminated. That's how it spread it in Wuhan and across the continent. If you look at the initial symptoms, what I see is most of them start with fever. You're surprised. A lot of people think it's running nose and all that, fever and cough, and rest of the symptoms like fatigue and shortness of breath. You can initially diagnose with a pulse ox. If people have a pulse ox, if they have a low oxygen level in your blood, you can pretty much tell even before your symptoms start. So a lot of people have been checking their own pulse ox at home. And as you can see, the fever leads to fatigue and other symptoms, coughing and shortness of breath, headache. And it's a confusing part is the incubation. I'm not sure how many of you are aware about the incubation period. Incubation is once it gets into the body, how long does it take to manifest? So the manifestation, it varies. The incubation period, it is around 14 days, but it varies. It's around 5.2 days. Suppose if I get the virus today, from 1 week to 2 weeks, it can manifest itself in the body. That's the incubation period. That's where, if you look in New York City, it has peaked because that incubation period has peaked, 7 to 10 days. Now it's slowing down. So the new people who are exposed to this virus, you still have to wait. In California, I don't know if you have reached the peak yet. So nobody knows. We are still looking into it. Okay, the testing. Originally, it started as we didn't have any tests. And we were all bemused again how to do testing. So originally it started as a throat swabs. Now it has become, there's a blood test they have discovered in China. And it's still not being practiced, but it's still, throat swab is the commonest test. And the test results used to take about 1 to 2 days. Now we can get the results back in about an hour, 1 to 2 hours. And there's also a self-testing kits, which is being given to a lot of folks, and there are a lot of drive-through testing is being done. Certain areas, like sometimes if you're in a prevalent area, they're doing the drive-through testing. So that's one thing to look at. And as long as if we have tested positive, what do you do? That's the thing which we are all puzzled. Nobody knows exactly how to take care of their health because there's no treatment, folks. There's no treatment. See, somebody timing it, so I'm hoping somebody is timing it. So as far as the treatment wise, I would say you need to enhance your immune system. You need to continue doing the exercises, daily routines. And how do you improve your immune system? By doing few things, like simple things like vitamin A, D, E, and they're saying even the zinc seems to prevent from the virus going into the cells and causing damage. Even the zinc seems to have an effect. So what I see is more and more are people taking a lot of vitamins. And if you can look at it, there's a new medications like hydroxychloroquine, which is given for the malaria. They have discovered that hydroxychloroquine seems to have an antivirulent effect. And also Zithromax. Zithromax is zithromycin, which you have been using all along, which is an antibiotic. It prevents the infections. It doesn't do anything to the virus. It prevents the secondary infection. So the main treatment so far is hydroxychloroquine. One thing which is really a blessing in disguise, people who have recovered from the viruses, they have developed antibodies. If you really look at antibodies, you can take the plasma from the recovered so-called victims, and you can use it to treat people who got infected if they're not getting better with routine medications like hydroxychloroquine. So the desperate attempt is to give plasma antibodies that seems to fight the virulent infections. So we have learned something which is going to be test of times. I'm sure we will come out stronger, and now we'll have new rules and regulations. Whenever there's a pandemic, we're going to be, taking all sorts of precautions. Especially when it starts as an epidemic, they need to have somehow contain the epidemic in one certain. I'm sure WHO, like World Health Organization, is not doing its job. It failed in its job. I really blame it on the World Health Organizations for not doing and basically misleading a lot of people. So I'm sure we'll look back and do certain things differently. So if you have any questions, most